thanks so much for joining. I am so glad you're here, and I am so thrilled to have my guest with me today, Apurv Gupta. And Dr. Gupta is just so amazing, and I'm so excited to introduce him to you guys. And this episode is not just for moms, but it's for healthcare providers, and really just there's so many aspects of what I want to talk with Dr. Gupta about today. So, he is incredible. I just met him recently, and I just absolutely love everything, all of our conversations. They just fire me up. So Dr. Apurv Gupta, he is a leader in driving transformational change in healthcare and leadership with the creation of a loving organization, utilizing love as the catalyst. And I just love this so much. Please tell us more about this incredible organization and concept. Thank you so much for being here, Dr. Apurv.
Oh, awesome. Thank you. Thank you so much, Valerie. It's amazing, honestly, to be here, to become friends with you in such a short period of time. I feel totally blessed. And in that period of time, you have just helped me go to a different level in terms of my creativity and collaboration. Just honestly, as you said, just the meetings with you are always so full of energy and ideas and a willingness to kind of keep exploring our frontiers. And I'll just have to say that clip that you were playing that just before we started was just also so a beat, and I felt like this is picking me up. I'm so glad you're playing this right before you're bringing the guest on, because it elevates all of us to go and explore those frontiers. So thank you so much. Very kind of you to have me on your show. I read your book, by the way, and I loved it. So let me put in a plug for that. To Mom is to Love. I think it's amazing. Learned a lot from that book, and I just love this whole theme that you're now developing of taking the mental back roads and kind of like how can we slow things down just a little bit more and appreciate and observe and observe when we are not taking the mental back roads, when our kind of mind is going on the autopilot highway and taking us down in a different track. So I really appreciate this idea of, hey, well, let's take a little stroll together. Let's enjoy the scenery. Let's appreciate where we're going. We don't always think we know where we're going. You can't always take the highway to get there, and you're going to miss a lot in the process. So I appreciate all that imagery that you've brought to us just through that theme. Now, with respect to the Loving Organization, it's something I'm really excited to share with you. First of all, I'll say you have recently joined us as a charter member, so I'm so happy and thrilled that you're participating. It's not just like you're interviewing me. We're kind of bringing this news of this idea and awareness of this idea to your audience, but we're collaborators in this. The whole theme and thesis of the Loving Organization is that the world as we know it, and really it's not just about any particular organization, it's actually rampant throughout society. It's certainly within our organizations, within healthcare, but also non-healthcare organizations, educational institutions, financial institutions, really even hospitality institutions are almost rife with fear-based management. That's the default. In the absence of having created any proactive approach to loving or loving systems, as we call it, most of our approach to working with each other is fear-based. And so that's the typical, in homage to your theme of motherhood, it's a typical patriarchal system that we're trying to, call out and bring in some more of the motherly and feminine energy to balance it out. But typically it's patriarchal, it's hierarchical, it's top down, command and control. We're going to tell you what to do. We think we already know what the right thing is. So we don't need to get your input and your answers. We're going to tell you what to do. You're going to do it. And then a week later, I'm going to come back. And if you didn't do it, then I will reprimand you, censure you, maybe punish you in some way, right? So that's the cycle we're all familiar with. That's like no one has created that cycle. It just is the default management style. There's no particular enemy here. It's not a we-they situation. It just happens to be the way we manage ourselves in our relationships, in our families, in our homes, and certainly in our organizations. So the idea of the loving organization is that there is an alternative. It's called love-based management, which most of us have just not maybe taking the mental back road to say, hey, fear can travel down that road very quickly, and can develop systems very quickly, and maybe communicate messages very quickly, because that's the highway. But the love organization is truly a back road, because it requires us to slow down, to be more mindful, to be more attentive, and to think, hey, there is an alternate way to get there. And guess what? It's actually going to get us to the same place. It's actually going to get us to maybe even a better place, get us better results, if we are thinking about how to incorporate loving systems into our management style. And we do that at the organizational level rather than at the individual level. Because what we find is that there's a lot of loving solutions that are being directed at individuals, in all good intention. There are many well-being solutions, wellness solutions like mindfulness, yoga, meditation. They're all being brought into our organizations. But if you think about those a little bit, they're being introduced to the individuals of the organization as, here's some things you can try to make yourself more loving, or to make yourself more calm or more peaceful. And which is actually not a bad idea, right? Because I do think it's a great thing to expose and introduce people to these concepts. But if that's the only thing we're doing to our people, then it leaves the people with a sense of, wait, I'm the one who's feeling overwhelmed, overworked, maybe burnt out. And now you're telling me to take 30 minutes out of my day and do something more. I don't have the time to take the mental back road, right? Now what's like, you're telling me to take the back road. You're taking the highway. You're going to get there faster than me. I don't have the time. So that time-based element winds up becoming then an additional pressure on the individual. With the loving organization, we're trying to redirect the energy to say, no, it's the organization's job to develop a loving environment, and it can do so at the collective level by creating more love in its systems. So that's the when you say what are the systems, typically you can break down any organization into its functional categories, and so some of the systems in a organization are things like workflows, policies, the culture, the teams, the leadership. All of these are different ways in which we can make them more loving. And ideally, the goal is that the collective impact of that will be an environment that's more loving for the people of the organization.
Absolutely. I think that is so spot on. And I think just so much that you're saying, Dr. Gupta, that is so needed. And it makes me think about, well, so many things. As a nurse practitioner, I feel like I've seen a lot of this on both the provider side and on the patient side, but also how it trickles down. And I just remember when one particular instance where I was just so scared. I was a patient. I was so scared, and I was, I think, experiencing a bit of like just trauma from, in my head, time traveling in my head, wasn't listening at all. I was looking at the provider's shoes. I remember that specifically their shoes. But what I remember the most is one of the providers, after that conversation, they came in and gave me a hug. And that hug is what I remember. Like, I mean, obviously, there's the stuff, the education and all that, that's important. The things that are done are so important. And I don't want to underestimate that, but also at the same time, we are underestimating those simple things like the hug, and how that made me safe, how that made me feel trusted, and how I feel like, both from like a patient side, but also as a provider side, supporting one another is just so important. It's not just fluff. It's not just, it is powerful stuff. And I'm so glad that you are bringing that to light. And really, you're making so many waves in so many organizations with this as well.
Well, that's an amazing story, Valerie. Thank you for sharing that. It's just amazing that, a simple thing like a hug could help make you feel so much better. And now that's what you remember, right? You don't remember really even anything else other than maybe the fear of the conversation and how you felt at the end. And now let's think about it. How much time did it take for that practitioner to just, instead of just walking out of the room, or maybe walk out of the room, come back into the room and just give you a hug? It may have taken 30 seconds. This is what the literature shows. Your whole show is about the evidence and evidence-based practices. In Compassionomics, which is kind of what I consider one of the Bibles of this whole field, written by one of the co-authors, Dr. Trisiak, who we had a chance to interview for our show. He talks about it, that it really only takes about 35 seconds extra to be compassionate compassionate or empathetic. And yet here we are, we're thinking, oh my God, this is going to be a long detour, a long back road. I don't have the time to go on that back road. Well, guess what? It's not a time intensive process. The back road is really more of a metaphor to say, just like stop and take some time, take 30 seconds, and you can reassure someone with a touch, with a gentle gesture, with just a few words, with the way in which you enter the room, with the way in which you leave a room, or just give you a simple hug. This is not actually going to become more time consuming for you. So I think that that's a message we have to really help to communicate to all of our providers, is that it doesn't take a lot of time. Now, from the loving organization perspective, what I always like to bring back is like, we should not be reliant or make our systems dependent on those heroic activities of individual practitioners, right? It shouldn't have to be that one doctor or nurse or therapist that just went out of their way and came back to give you a hug. We want that back road to really be the road. We want the road, that to be the road everybody travels. That's the scenic route. That's the enjoyable route. Why wouldn't we want to go down that way? You're going to have more fun on that road. So we want everybody to be using that road. I don't want to carry the analogy too far, because then I'm sure people are imagining how congested that road is going to be, and backed up. But nevertheless, the point is that we want the organization to really emphasize that that's the road we want you to take. We don't want you to be fast and quick and efficient only. We really want you to take a little bit of extra time with the patient. Now, if the organization can create the systems that support that, the policies, the culture that supports that, the leaders emulate the same thing when they're dealing with their physicians and nurses. They're not just walking into a meeting and delivering the message and walking out. They're also taking that extra 30 seconds to be a little bit more loving and compassionate. Then that role modeling spreads throughout the organization. And that's how we can work together through the loving organization and through the work you're doing, Valerie, with us as well as outside, to help really people understand that all of us have a role we can play in making this the hugging approach from the practitioner into more of a systems-based approach that others can also emulate.
Oh, I love that. And I love how you talk about both the individual level, but it's not necessarily the individual, it's the organizational level as well. And I think that's so important. And
Yes.
I think that, I love how you're having all these analogies with the roads, because it's so much is this, what it really only takes a few more seconds, but also that the more you practice it, the more you do it, the more well traveled it gets, the stronger it gets, the easier it gets, and it's something that I think, as you're talking, it makes me think of dog therapy, which is interesting. Like I remember that with some of my hospital experiences on the patient side, the dog would come into the room. Okay. And I remember this was in a pediatric sense. And I love that. It's such a great thing for our kids to have. But also, I'm going to have to take a mental back road in a second.
Yes.
But
You're doing good. Yes, a few deep breaths. Hopefully she's okay. You want to check?
She seems okay right now.
Yes.
Yeah, I think things
Fingers crossed. Hopefully she's just having fun on a rainy day.
Yes, yeah. But yeah, no, she's good. Anyway, apologize for that. This is the joys of summer break live streams, right?
Yes,
But anyway, I feel like with these pets, with these, we have this help with patients, but also what about with like family members, with staff, with people that are also giving care? And then it makes me think about just how we talk to, I don't know, sometimes like with my dog, I can be short with her. I can say I have certain tones with her, and she will listen when I'm more open. Sometimes like if I'm too like this scolding, the dog is not going to want to listen as much as if I'm open, and so I just feel like that kind of gives me a bit more of perspective, or that's just something I'm thinking about as you're talking.
Absolutely. No, I totally agree. And I think you actually wrote about that really well in your book. So I hope many of your audience members have read the book and learned about how these pathways work and why some of these are considered highways and why back roads. I mean, I think that analogy you've laid out is really beautiful. I think there's a couple of the points to remember. One is that when we operate out of fear, then what we're doing is we're shutting down creativity, we're shutting down cooperation, we're shutting down collaboration. And so I just want to get my task done because I feel like I'm getting judged and it's all up to me, and I'm being managed as a unit of one typically. So I just need to get my work done, and I'm not so much focused on what other people are doing or trying to expand and be more creative. So I'm really shutting down the process, which is kind of where this whole management system came from, right? It came from a very factory mindset back in the industrial age when people thought they knew what they were producing. They had to produce a certain widget, and they had to just produce that widget of a certain quality. So it was a very top-down process that
Yeah.
could be layered down from CEO down to vice president to manager to supervisor, and just standing over people and literally making sure they're stamping out the item that they need. But that's not the world we live in. That's not healthcare. It's not clinical care. It's not medical care. And healthcare organizations are far too complex organizations for us to think that we as leaders already know all the answers to the situations. And so we're just going to police and supervise and hand down guidelines and dictates. We actually have to be open to the workers themselves, the people on the front lines who are the closest to the work, being more aware of what needs to get done and giving them the latitude through our policies and our workflows. That's kind of where loving systems comes in, so that they don't just hew to the policy and say, well, it's outside my policy, I can't do this. No, they look at the policy and say, okay, maybe this policy doesn't quite cover the situation, but you're my patient in front of me. Let me see how I can help you. Let me talk to somebody else. That's the back road we want people to take. It's not that we don't need policies. We're going to throw everything up in the air and burn them. No, it's not anarchy. It's still an organization. It just can be run in a little bit more of a loving way if the intention is there to be more loving. And that comes from, all across. It's from the leadership. It comes from the middle management. It comes from the front line. It comes from the patient. All of us have an opportunity to be more loving and to embed that love into the systems so that we have an approach to the policy that's more empowering. The manager doesn't just come with the policy and say to the nurse, hey, you didn't follow the policy. Manager says, hey, good job. I know you didn't quite follow the policy. I understand why. Let's talk it through. What should have happened? What could have happened? Do we need to amend the policy, or did you actually do the right thing by just trying to advocate for the patient? So is the manager doing that? Usually not, because they think it's going to take more time.
Yeah.
They're just following that highway. They're following the protocols. They're following what they think are the protocols. Well, there are ways to create those protocols to be more loving. That's what we're trying to advocate for. The good news is that there are examples out there of loving organizations that are already doing it. So this isn't just theory. We're not making this up. I'm a consultant by day, and really what I do is simply observe. And we found several organizations, as I call it, in the wild. They are already out there. They're already loving organizations or aspiring loving organizations. They're the ones that are teaching us that it's very possible to do this. And when you do, you're going to improve quality. You're going to improve safety. You're going to improve the patient experience. You're going to actually reduce burnout and turnover. And overall, you're going to improve profitability. So this is actually the promised land of where everybody wants to get to. You just can't get there on a highway. You have to take these back roads, these loving back roads, to deliberately craft a different approach, and then you will get there, and you'll actually get to a better place than where we're trying to get to today.
Absolutely. I think that's so spot on. It's so spot on. And I love how you are saying all that. And it makes me think of that quantity over quality. I think so much of that in healthcare is emphasized these days, but also where the quality is going to be ultimately more like, if we want to talk about numbers and all of this stuff, like think about, like, I really feel like that I would love to see more quality metrics out there. I'd love to see more of this out there to see how much that really can impact the bottom line from that side as well.
Yeah, I think I'm with you, and I'll kind of say maybe yes and to
Yeah.
that. One, I would love to see more metrics in this area too, because I think it will help. And at the same time, all these loving organization exemplars that I'm mentioning, they're
Mhm.
actually just managing to the metrics that they already have, but they're doing it with love. So they haven't necessarily added any new metrics. It's quality metrics, safety metrics, patient experience metrics, staff member experience metrics, and overall financial metrics. So this is not about one or the other. This is not about now favoring a different mechanism. This is not about purpose over profits or mission over margin. We're just saying they both are important and they need to be harmonized. You can ultimately leverage whatever it is you're already doing in the organization, but just with the right intent and with loving systems, you can make your whole organization more loving, which then allows all of your people to operate at a higher level. So hopefully more of those people feel like, hey, I'm not going to get punished or censured if I go back in and hug my patient. That's the right thing to do. I see everyone else around me doing it. So why don't I spread the love too by going back in and giving some reassurance? That's the goal, is like uplift everyone through the systems of the organization.
Mm. I love that. Such amazing points. And Dr. Apurv, I feel like I can talk with you all day. I absolutely love all of this, and it just really makes me so excited for all the change that a loving organization can create, will create, and so looking forward to collaborating and being a part of this. Can you please tell anyone who's listening to the live stream today or to the replay where they can learn more about a loving organization, where they can connect with you, and anything else you'd like to share?
Yeah, I love it. Thank you for the opportunity. I think you've got this such amazing setup. You've got a nice banner scrolling on the bottom. So go to I should say www.alovingorganization.com. Check out our website. It's still early stages, but we're building out material there. So you can see some case studies and some of the research and some of the thought process there. I would love to connect with you on LinkedIn. Just connect with me, Apurv Gupta, MD on LinkedIn. Reach out. Let's talk. Let's find a time. That would be amazing. And I guess the only other thing I'd say, just because maybe we have limited time, I was thinking a lot about this in the last 24 hours, just thinking, Valerie, about what is the message we would want to deliver together. And it was really stimulated by one of the questions you had been prompting. I think it is that I'll go back to that message, that fear sometimes feels more powerful because it can be faster. The pathways and the highways that it uses can be faster. If there's fear in a particular setting, it can spread very quickly because, it's the fight or flight response, which is very infectious. If you get fearful, suddenly I get fearful, and that anxiety picks up really quickly. And so that's what a lot of people use to consolidate power, is the knowledge that they can leverage fear to control other people. Where love starts to win is in the sharing and the connection, the collaboration, and in the systems. When we start holding hands together and actually working together, building systems together, knowing that we're all working on the same thing together, creating a team, creating a consortium that's working on this together, then creating systems, bringing it into an organization, that becomes a very powerful, loving system that fear actually is not really able to penetrate. And so that's, I guess, my bottom line. I feel that we often have this debate with many people, and maybe it's not a settled debate. Is love more powerful than fear? I guess there could be a lot of spiritual speculation on that. I'll just say, even if it appears that fear is faster and sometimes more dominant, I believe that in the power of love, because I know what can happen when we come together and create loving approaches and loving systems and loving organizations.
Oh, I love that. So true. And it's more the human side, right? Like fear, all animals have, and you can debate love and all of that. But when we use love, we use a different way. We use it, our human side. It's more human. I love it. Yes. Mic drop there. That's wonderful.
Awesome.
Thank you so much. I really appreciate it. Everyone, please check out all of this incredible work a loving organization has to offer and connect with Dr. Apurv. He is just amazing. Just love him and all the incredible work he's doing. So thank you so much again. And I hope you have a wonderful day.
My pleasure, Valerie. Love working with you as well. And thank you for having me on this show. Really appreciate it.
Thank you so much.
Take care now. We'll talk soon. Bye-bye.
Thank you.